everyone. So today's workshop is going to be about preventing infectious diseases. So let's get started. This is our table of contents. So we're going to first talk about what are infections. So we will discuss the common types of infections. We will discuss about the causes of infections. We'll talk about symptoms of infections and who is most at risk of getting an infection. We will then talk about how we can prevent infections. So we'll talk about personal hygiene, hand washing, and how to sneeze and cough in public to protect yourself. So let's get started on the first part, which is what are infections? So an infectious disease is a disease caused by a pathogen, or what we can also call a germ, such as a virus, a bacteria, or a fungus. Right now, you probably have all heard about the common virus that's getting everyone sick, which is the COVID-19 virus. They enter our body and cause symptoms of infection. We will discuss the symptoms soon. Common infections that you may have heard of are the influenza, which is the flu that we get every winter. This is also caused by a virus, or pneumonia, which could be caused by a virus or a bacteria. So what are common symptoms of infection? The first one is fever, which means an increase in body temperature. So when you measure your temperature by thermometer, or when you put your hand on your forehead, you feel that it's warm. That's one sign of an infection. Another one is chills or feeling cold. So even when it's not very cold outside, you're still kind of feeling chilly, you're feeling cold. That could be a common symptom of an infection. Fatigue, so just feeling tired and lazy all the time. Coughing. So sometimes when you cough, something might come out like mucus. There's different colors of mucus, so those colors can tell us if there's an infection or not. Sore throat, there's nasal congestion, so just feeling like your nose is just very congested, you're having difficulty breathing, rashes on the skin, and diarrhea. It's important to note that if the symptoms persist for a very long time, or if they're getting worse, then it's a good idea to get help from a doctor. So who is most at risk to get an infection? The people most at risk are the first one being pregnant women at any stage of pregnancy, but of course during the third trimester, the risk is highest, so we have to be even more careful. Second one is children aged between 6 months to 5 years old. At this age, their immunity is still building, they're touching everything, they probably don't wash their hands properly, so they're at high risk of getting an infection. Third is individuals with chronic medical conditions, such as high blood pressure, diabetes, any kind of heart condition. That puts them at high risk of getting an infection. And fourth is elderly individuals. So again, they have a lot of other conditions that we talked about, like chronic medical conditions, their immune system is not very strong, so they're also at high risk of getting an infection. So we'll now discuss the different modes of transmission, which means how infection can spread from one person to another person. So as you can see in the image over here, the person in red is the person who is sick or who has an infection, and the person in white is the person who is fine, who's not sick. And there are two main ways that the person in red can spread the infection to the person in white. The first one is direct, and the second one is indirect. So what do we mean by direct and indirect? Direct means when you cough or sneeze, the particles, they stay in the air for about 3 feet distance. So if the person who is not sick comes within 3 feet of the sick person, then he can catch the infection, as seen on the picture over here. This again depends on the size of the particles, but on average, it's about 3 feet. If you come within 3 feet of the person who is sick, then you can catch the infection if that infection is spread by direct mode of transmission. The second one is indirect, and there are 3 main ways that the infection can spread. There's airborne or aerosol, number 2 is contaminated objects, and number 3 is through food or water. So let's talk about airborne or aerosol, which is the first one. Airborne are tiny droplets that can stay in the air and they can travel through wind. They don't just stay 3 feet away like the droplets one. So as you can see in the picture over here, if this person had an indirect kind of infection that was spread by indirect method, and if he were to cough or sneeze, then the particles would just stay in the air like this, like smoke, for example, as you see in the picture, and they can travel through wind. So if another person comes around this person within any distance, he can get sick. And these infections are much harder to control. One example is, for example, if you're in an airplane and there's a person who is sick with, for example, measles, which is a disease that can be caused by airborne. And if anyone else in the airplane that comes around that person, or could even be a little bit further from the sick person, can still catch that infection. So these are much harder to control. The second one is contaminated objects. So for example, if there's a person who is sick and if he coughs or sneezes in his hand and he touches like a doorknob, or if he touches any kind of surface, and the particles can stay there, and if someone else just comes and touches it, then they can also catch the infection. The third one is through food and water. So again, that could be, for example, sharing the same utensils, or sharing the same spoons, forks, for example. It could be through food and water. So bacteria can contaminate water, and then if you drink that water, you can also get that kind of infection. So let's talk about, let's discuss the summary now. So if we talked about what is an infection, so as we said earlier, it's a disease that can be caused by a germ. It could be a virus, a bacteria, a parasite, fungus. Virus, as we said, could be the influenza virus, the COVID-19 virus that we're seeing now. The signs and symptoms, the common ones are fever, chills, fatigue, etc. There's certain populations that are higher risk of getting an infection, for example, pregnant women, children, elderly, or people who are already sick with like high blood pressure or any kind of heart conditions. The infection can be transmitted through different methods. So we said there's direct methods when you cough or sneeze and then there's someone around you, let's say within 3 feet, or indirectly, for example, through food, through objects.
Now that you know a bit more about infectious diseases, we're going to discuss some of the ways you can prevent infections. The first and most important thing is to wash your hands. Hands are very dirty. We touch doorknobs, bus rails, trash, diapers, and we get bacteria and viruses on our hands all the time. Washing with water and soap can kill almost all of the bacteria and viruses on your hands. If you don't have access to water and soap, you can wash with a solution of 60% alcohol, so hand sanitizers such as Purell also work well. When you're washing your hands, it's important to do it for at least 20 seconds, and it's important to get all the crevices of your hands. So for example, the back of the hands, the thumbs, and under the nails. It's important to wash your hands as often as possible, especially before eating, after going to the bathroom, after coughing, sneezing, blowing your nose, and after going from any public crowded space, such as public transport like the bus and the metro, or coming home from the grocery store. Now we're just going to watch a small video about how to properly wash your hands. The black paint simulates the soap. So first, the palms of the hands, then in between the fingers, then the back of the hands, then the tips of the fingers like this, then the thumbs, under the nails, and finally the wrists. Then it's important to limit the spread of bacteria and viruses as much as possible. Try to sneeze and cough in tissues and throw them in the garbage right after. If there are no tissues available, you can sneeze and cough in the bend of your elbow, like this, and wash or disinfect your hands afterwards. When you sneeze and cough, it causes a lot of little particles to go out from your mouth, which can go onto other people and make them sick. You should try to teach your children to do the same thing. Also, try to touch your face as little as possible. If you have bacteria and viruses on your hands and you touch your face, they can go into your eyes, your nose, your mouth, and make you sick. Also, try not to touch any cuts or pimples, since that can cause bacteria and viruses to enter your body through your skin. Finally, you should try to avoid sharing personal items such as utensils like forks and spoons, drinking glasses, and personal hygiene products such as toothbrushes or razors, since if they are sick, you can become sick too. If you are sick, try to avoid contact with other people as much as possible. Now I'm just going to talk a bit more about wearing masks. Masks can be really helpful, especially if you are sick, to protect other people from getting sick too. It's also a great way to protect yourself when you're taking care of sick people or if you're working in a hospital or a clinic, for example. Now, it is also recommended to wear masks inside of public crowded spaces such as the bus or the metro. Now, I'm just going to do a small demonstration of how to wear a mask. When you take your mask, you should always take it by the ear loops like this. Then you should put it behind your ears. And if you have a mask like mine, you'll have a small metal bar at the top that you can pinch so that it goes around your nose. When you're wearing a mask, it's important that it covers your nose and your mouth. So if your mask is like this, it's not good because bacteria and viruses can still enter your nose and you're not protected. When you're wearing a mask, you should avoid touching it since you can get dirty things on your hands. When you're done with the mask, you should always take it by the ear loops and avoid touching the dirty part of the mask, which is the front. Then you should dispose of it properly. After taking off a mask, you should always wash your hands with water and soap or with hand sanitizer. Finally, we're just going to talk about cleaning food and surfaces. So germs can remain on foods such as fruits and vegetables, so it's important to wash them under water before eating them. Also, you should always store food according to their labels. For example, meats have to go in the fridge, since if they're left in the heat, bacteria can grow in them and make you sick when you eat it. You should always cook meat thoroughly, since raw meat can make you sick. You should always be careful of expired foods. So for example, if it smells bad, has a weird texture or color, this could mean that the food is rotten and could make you sick. Finally, you should regularly clean surfaces or things that you touch often in the house. For example, tables, toilets, children's toys, door handles, remotes, or mobile phones. To do so, you can use a bit of soap and water or a house cleaning product that you can buy at the grocery store or the pharmacy. In summary, to prevent infections, you should wash your hands with soap and water for at least 20 seconds. Sneezing and coughing should be done in the bend of the elbow. You should always clean fruits and vegetables before eating them. And finally, you should regularly clean tables, counters, and phones.